It is early identification of children at risk for delays, which can interfere with our development. So we are trying to identify the child as early as possible. A very, very simple screening checklist is this, DOC. This is called Development Observation Card. We use it in India. Simple. 2 months, social smile. 4 months, head holding. In both, pull to sit, and when the child is on the tummy. 8 months, sitting alone with back straight. 12 months, standing alone. Make sure the child can see, hear, and listen. Those who fail this simple milestone must have a formal developmental assessment. A very simple development observation card which we use here in first year of age. And red flag signs. So every age there will be some signs which tell us that if this is not achieved, please, maybe we need to take an opinion or think if something has to be done. If this is important. So let's start with 3 months. Head leg being made to pull to sit. So this is a doll. I am pulling the doll and the doll is leaving the entire head behind. Is not accepted at 12 months of age. Sorry, 3 months of age. Prone. The child is on the tummy. The child is supposed to lift up the head on the forearm. The child is supposed to go up like this. Fine motor. Even if the child is not reaching for the object, at least the child should mouth hands at 3 months of age. Communication. Child starts responding to sounds. The child starts cooing on being talked to. Social emotional. Smile. The child gives us eye contact and starts smiling back. Everywhere we come to the same thing. Please look at social smile. Please look at eye contact. This is perhaps one of the most important part of development which we are not supposed to miss in the first years of life. So what will happen at around 6 months of age? If the child is not able to hold head up with control when made to sit with support. So the child is sitting with support and the head is going here and there. Okay, again, the child is supposed to go up on forearm when the child is on the tummy. Now at around 6 months of age, the hand should start coming in midline to reach for object. And the child should explore the object. Look at it, hold, do like this, put it in the mouth. Or if there is fisting. 6 months of age, fisting, not accepted. Babbling is now starting. Ah, ooh, this all starts and the child starts responding to his or her name. Again, we came to eye contact. Social emotional, not giving eye contact, not smiling, not responding to caregivers, we are worried. Okay, so let's do at 7 to 9 months of age what we are seeing. No rolling. The child should be able to roll both front to back and back to front. The child should be able to sit with back straight without support. Some mobility should come. So either the child is going in front on the stomach or crawling. And if you are making the child stand, the child should be able to take his or her weight on his leg. It is not that the child is going out of your hand or slipping out of your hand. Fine motor. The child should now manipulate the object. One hand, another hand, start banging. See if something can be done about it. If you give a bell, the child start looking what is there, to start looking at details of the object. Again, syllables. Baba, dada, papa. These are lip syllables. Ba, pa, ma. All these syllables start. Some communication start, like gestures, by not exactly waving, but if the child wants your attention, the child may do something. The child starts sharing the enjoyment. They found something funny, they like this, they will try to take our attention towards them. You see, I found something great. And the child wants our attention. The child is not into himself or herself. The child wants our attention, that please pay attention to me, I am there. So let's go again further. So let's see, 10 to 12 months. Now the child should be able to crawl or cruise. Cruise means holding on the object and walking. Child should be able to pull self to standing position. If the child is sitting down, hold on to some object and stand, and after that being able to stand without holding on to object. and not able to stand without support at around 12 to 13 months of age. Fine motor, at least 3 finger grasp is to be there. Child should be able to hold the sippy cup or something on his own and try to feed himself or herself. And finger food, many of the kids are able to feed themselves. Communication, child should now start responding to familiar words like mummy, papa, mama, papa, like that. And they should now start speaking baba, papa, mama specifically. So papa looking at papa, mama looking at papa. Social emotional, they should start noticing someone, something new is happening, someone new is coming. And this is the age where the peekaboo starts. Where are you? I am here. If you ask the child to throw a ball, child will at least make some effort because the child is now understanding what we are telling her. At around say 15 to 18 months of age, if child is not attempting to walk without support, and 18 months, the child should be able to walk without support. The thumb finger grasp is now developed. At around 18 months of age, scribbling like this, the child knows that the function of this object is to do this. So it is along with the part of fine motor, it is also a part of imitation. And the child will stack 2-3 blocks after we give the child demonstration. Some clear words start coming, but more importantly, simple request the child starts understanding. Where is your shoe? Show mommy. Simple requests start coming. Again, very important in social emotional is the pointing. Pointing are 4. First, the child will point for need. Then I showed the child, see, aeroplane. The child will look. After some time, the child will try to show us what he or her he found interesting. See, you see because I liked it, so you also see it. And then the child will start pointing if we ask him. And the child is not showing any interest in interacting with others. By 24 months, child should be able to walk independently with good coordination, up and down stairs with support. The child should start trying to use the spoon. So again, the same thing, it is a part of imitation also. It is a part of fine motor also. It is a part of gross motor also. The development always go together. Fine motor, the child should also try to help us with dressing and tower of 5 to 6 cubes. 2 years, understanding of around 50 words, and the 50 words has to be with meaning. The learning of new words has started and simple 2-word phrases have started. Social emotional toys are to be used purposely. Toys are not just thrown about or not just mouthed, they are used purposefully. Basic pretend play. Feed the doll. Make the doll go to sleep. All these things starts, or a child who prefers to play alone. So that we need to worry about. So 2 to 3 years, let's see what happens in gross motor. If the child is not able to walk up down stairs independently, 2 feet per step. Not able to run smoothly, not able to jump, not able to ride cycle. Fine motor, child is not able to manipulate small object like beading and does not at least attempt everyday self-care skills like feeding and dressing. 3 years, the child should be able to use simple 3-word sentences, very unclear speech, simple directions the child should be able to follow. Close the door, bring me the glass, put the book on the table, and answer simple questions. What is this? What are you doing? Simple question the child is able to now at least attempting to answer. Social emotional, no pretend play, not interested in interacting with other children, and not recognizing others' emotions. So the mother is upset, does the child realize it? Mother is angry, does the child realize it? So that all starts coming. Around 3 to 4 years, now the child is able to walk, run, climb up, downstairs confidently, alternating feet for going up the stairs, and the child is now able to steer the cycle. Pencil, 3 to 4 finger grip has started coming. A child who is absolutely not toilet trained during the day, and by toilet trained doesn't mean the child prefers a diaper to do potty. Toilet trained is having no indication only that I have done something. So the child is able to tell us before going to the toilet, not able to draw line, circle on what you say copying. I have made one, the child is making one another. Communication, the speech is very unclear to outsiders. Now 2-point instruction. Close the door, close the window. Bring me the book, bring me the pencil. Bring me the book and pencil, close the door and bring me the door. So all type of 2-point instruction the child is able to now follow. Very well able to now answer what and where question, and the pronouns are now there. And social emotional, not able to play with other children cooperatively or prefers to play alone most of the time. For 4 to 5 years, now the child should be able to walk, run, climb stairs, jump confidently, come downstairs alternating feet, and in 5 years, the mature heel-toe walk should be there. Fine motor, simple drawings now start. I mean, the stick man, which you all used to draw one circle, one this, okay? Not able to independently complete simple dressing and eating routine. Now the question he has to ask, what, where? Where's mommy? What are you doing? Difficulty telling parent what is wrong. A crying kid and we are asking, what is wrong, beta? And the child is not able to answer us. And the child is now able to answer us why question. Social emotional, again, not able to play in a group and not able to understand rules of simple games. And what will be the red flag sign for every age? Starting from 3 months at any age, if there are strong parental concerns. Any age, parents are the best judge for their kids. Poor response to sound and visual stimulation, which means eyes and ear. Poor eye contact over 3 months of age, it has to be taken seriously. Poor social response to caregivers, again over 3 months of age, it has to be taken seriously. Loss of skills at any age. I have achieved this milestone and I have lost it, is to be taken seriously. Or we are stuck. We have reached till here, we are not going further. If there are differences in left hand side of the body in strength and movement, handedness, if the child is showing handedness at 18 months of age, we should worry why. Handedness should not come before 3 years of age. So the strength and movement of both sides of the body, we have to see. Significantly low body tone, a very floppy baby or a very stiff baby, both we have to take care of. Although this is not the webinar for it, please don't miss this. It is 1:54. Out of 54, one kid is having autism and it has to be caught as early as possible. And it has a very good screening checklist available at 18 months of age. Every kid should undergo this. It can be done on the net by ourselves or we can ask our doctors to do it for us. So why it is important? Why so much? Or why do we need to know about early child development? Why have to we know? Why we want to know about it? Because there is a concept of brain plasticity, which means the ability of the brain to change with learning as a result of experience. Like even Government of India has started a program that first 1,000 days of life are important. So there's a reason behind it. Because brain plasticity is more efficient and effective during early infancy and during early childhood. That is why the brain is developing from 35 to 45 centimeter in first year of life. It is very plastic and it is pruning itself. So you can see what is important is sensory, then comes motor and language, and then comes higher cognition. So we have to work here, which is less than 3.5 to 4 years of age, which is the age where if we are finding children who are having developmental delays, have to be worked upon because the brain is plastic and our results will be much better than if we start working over 5 years of age. And there's a concept of early intervention, which is about taking actions as soon as possible to tackle problem for children and families before they become more difficult to reverse, which means what we are trying that what at this moment is a point of concern should not become a disability later on. We want to take the child out of it as soon as possible and as far as possible. It's not that we will be able to do completely, but we will be able to do a lot.